Okay, so let's talk about the wrist. So the wrist gets really swollen when you're pregnant. As we know, there's a carpal bones right here. There's the radius that comes in here, the ulna that's here. But this small container gets really swollen, right? So as a chiropractor, we can adjust this area. If you remember your extremity adjustments, the most pertinent is this scaphoid right here. Her arm is her hand is swollen a little bit, but normally there's a box. You can see on me, there's a little box. You can't see her box unless she. So in this area, the scaphoid is the most important bone to understand because your balance is off when you're pregnant. I personally fell on my face when I was pregnant because you're just off. So if somebody has a foosh injury or a fall on outstretched hand, one of the most common places to fracture is here. So if your patient has pain after a fall, you really, really need to send them for an x-ray, shielded of course, because as you remember, the scaphoid doesn't have a great blood supply, so it tends to have avascular necrosis, which is permanent and will erode the bone. So you want to be really careful if you had a patient that has that wrist pain. But if it's overall just plain wrist pain from just being pregnant, your hands being swollen, the money on this is not actually here. It's up here in her elbow, which is called the pronator, which is right here. So you remember the pronator teres is like a screwdriver motion, so that's what it does. So we want to do the opposite way. I'm going to do a little release here. I'm going to hold her here. This is going to be a little uncomfortable. This is not fun. So I'm going to bring it here like this. Very gentle. That's not too bad. Doing okay? So just that screwdriver muscle. Sometimes the patient's hand will get cold, so you want to be aware of that. Right at the end, I'm feeling that little knot. So yours isn't too terrible. We want to make sure we're doing that because this controls the wrist, right? It's also very bruisey. So that's the first thing to do. The patient can work on that themselves. If you put a little bit of cream, she can get in there and work that area and move her arm back and forth, right? Second thing we're going to work on is wrist. I got you right here. But I'm going to just take her wrist. I joke that I'm making butter, so I'm going to do this. So I'm going to take my finger. There's no structures in here to be like sensitive to, like on the other side. I'm going to show you that. I'm going to take her, and I'm just going to take her wrist and strip this out as I feel.
So good.
Yay! And so we're going to do 3 planes. 1, 2, 3. Little trinity in the wrist here. I'm going to go here. Doing okay?
Yep.
And then here. Feel that right there. That's the money. We're going to flip this over. As we know, there's a lot of vasculature. Do not hammer here because this will bruise and it will swell. So I'm going to stick down here, but there are vasculature, so we don't want to take as hard of a contact. I'm going to run up here. Again, taking her wrist away from what I'm doing, so it gives it a nice stretch. This is called mobile. I can't call it active release. Sorry, we'll just scrub that part. But it's called active release, but you're not allowed to say that. Right there. So this is called stripping. But we want to stop where the tendons end because if not, we're going to get a huge bruise there. So let's have you do that. I'm going to put some of this on here, right there. What I want you to do is to take your own wrist. I'm going to watch them. Take it here and you hold it here and just go away. So if your wrist is really bothering you, you can really get in there. Yeah. And then you can flip it over and then do the other side.
This way.
Yep. Or this up towards you always go away from the joint. So you're going to extend, like that's a perfect question. You're going to go up this way. So you're going to go like that and extend. And then bring it up like this and keep doing that. Like, feel it? Yeah, that's. And then you're going to turn your wrist over and then try it this way. I'm going to give you some cream. Here, try it again. If you use the tip of your finger to like get it in there. Yeah, that's the money. Yeah. I do this with like 60 patients a day. Your thumb's probably already tired. Yeah. That's why I have 6 packs of my thumbs. And then just go up here. So this you don't want to hammer. So you just want to almost like hold it, like grab it in the groove. Feel where it's tender.
Yes.
And then you can move your arm back and forth. Like that. Okay. And you want to pin, if you get stronger thumb, you can pin it down and just hold it. Yeah, it does. Use pin stuff. That's terrible right there. Yeah. You can also move it around like this. So you can move this around, like if you had a partner, to move that around like that. So how would a chiropractor adjust this would be to come in here like this, that, and then here. You don't want to do a lot of force here. It's not going, it's not going, it's not going. You can also adjust this elbow and adjust this radius. Cool.